Okay, let's dive in. We've got quite a mix of sources today.
Yeah, it looks like we're covering everything from, these big global standards for healthcare quality
Then safety,
and safety, right, through to the organizations helping hospitals actually meet those standards.
and then down to something really, really practical, like advice for visiting someone in the intensive care unit, the ICU.
Exactly. So the mission today, I guess, is to kind of connect those dots.
Right. How do these big ideas about quality and safety, how do they actually impact you maybe when you're in that really sensitive situation of visiting the ICU?
And we see these major players mentioned, like Joint Commission International, JCI.
Our sources point to them as well, a global leader, it seems.
Definitely. Working in, over 70 countries. Their whole goal is setting and affirming the highest standards for care.
Kind of like the gold standard setters.
Pretty much. They have accreditation programs, certifications for specific things like clinical care,
Yeah.
even newer stuff like sustainability in healthcare and telehealth.
Oh, okay.
And they've got these international patient safety goals, patient safety pathways. Getting that JCI stamp, it's a big deal for a hospital. Shows a serious commitment.
And it's not just global, right? The sources also bring up NABH in India.
Yeah, the National Accreditation Board for Hospitals and Healthcare Providers. They're part of the Quality Council of India.
So setting similar kinds of benchmarks, but tailored specifically for India's healthcare system.
Exactly. So you see this drive for quality both internationally and nationally.
But, okay, having standards is one thing.
Yeah.
Making them happen in a busy hospital, that sounds, well, complicated.
Oh, incredibly challenging. And that's where organizations like Supreme Medic Consultancy seem to come into the picture based on our sources.
Ah, right. So they're like partners for the hospital.
Kind of, yeah. Helping them navigate all that complexity from, the initial planning stages right through getting accredited, like with NABH.
So practical help.
Exactly. And it looks like they do more than just the accreditation side. Things like recruitment support, operations management.
Okay, sort of a wider support system. And they seem connected to platforms like HospiMatch, too.
Yeah, which provides content, resources, looks like stuff on financing healthcare, managing chronic diseases, patient care trends.
And what's really struck me is how some of this content, maybe from that Lifelines podcast associated with them, it really zeroes in on, visiting the ICU, taking these big ideas and making them super specific.
Yeah, that's where it gets really grounded, doesn't it?
Totally, because the ICU, it's just such an intense place, medically, obviously, but emotionally, too.
Right, and the sources are really clear. Visiting there isn't casual. It needs a different approach.
Yeah, like one source said, your presence should, quote, comfort, not complicate.
That sums it up pretty well. Understanding how to visit properly, it's not just, good manners. It's actually part of patient safety, part of supporting the care.
And that guidance seems really detailed in the sources, linked right back to keeping that safe, controlled environment that the JCI and NABH standards are all about.
It is. Very practical. We can probably pull out the key do's and don'ts, right, from what we've read.
Okay, yeah, let's do that. Let's maybe unpack the do's first.
Yeah.
The things you absolutely should try to do when you go into an ICU.
Right. Well, the first one seems simple, but it's foundational. Follow the hospital's specific visiting hours and rules. Strictly.
And that's not just arbitrary, is it?
Not at all. The sources stress it's about keeping things quiet, sterile, which is crucial for healing, and, importantly, preventing infections.
Okay, so things like hand washing, maybe wearing masks or gowns if they ask.
Exactly. That directly connects to those infection control standards that, JCI and NABH are so focused on.
Right. Makes sense. Okay, what else? Another dough.
Maintaining your own composure. Being calm.
Ah, okay. Your mood affects the patient.
The sources definitely suggest that. Your stress or anxiety can potentially make the patient more anxious, maybe even hinder recovery a bit. Speaking softly, moving calmly. It's about bringing peace, not more stress.
Yeah, makes sense. And what about, like, physical contact? Holding a hand or something?
That needs real caution. The rule is always ask the medical staff first.
Okay.
Patients might be very fragile, hooked up to monitors, maybe in pain. A gentle touch might be okay if staff approves, but you have to be so careful not to disrupt anything. It's respecting their medical condition.
Which is what those care standards are trying to protect.
Okay.
So, tech first.
Definitely. And while providing emotional support is, huge.
Yeah, that's why you're there.
Right. But the sources say keep conversations light. The patient needs rest more than anything.
So, no heavy discussions. Respect if they're sleeping or just seem tired.
Exactly. It's about a brief, supportive presence, not necessarily a long chat.
Got it. What else? Staying informed.
Yeah, that's important too. Staying in touch with the medical team, getting those daily updates.
How does that help the visit itself?
Well, knowing what's going on helps you be a bit less anxious yourself, maybe? And you can coordinate better with the staff if you have a sense of the plan.
Okay. And one more do that stood out to me was about the staff.
Oh, yeah? Showing appreciation.
Right? Acknowledging how hard they're working in, a really stressful place.
It's a small thing, maybe, but it fosters a better atmosphere, shows that you see their dedication to that quality care, kind of the human side of it all.
Yeah, definitely. Okay, so those are some key positive actions. What about the don'ts? The things to avoid?
These are just as vital because, ignoring these can actually work against the patient's care. Okay.
Yes.
Top of the list.
Don't overcrowd the room. That comes up again and again.
Because ICU rooms are small, packed with equipment.
Exactly. Too many people just adds chaos. It stresses the patient, and honestly, it gets in the staff's way.
So the advice is like 1 or 2 visitors max.
Generally, yeah. Coordinate with the family.
Right.
And definitely check about kids. Often they're not allowed, or there are strict rules. It's just too easy for them to disrupt things unintentionally, of course.
Right. Okay. What's next on the don't list?
This one's huge. Do not ignore hygiene protocols. Absolutely non-negotiable. Because patients are so vulnerable to infection.
Extremely. So rigorous hand washing, using the sanitizer, wearing whatever protective gear they provide, masks, gowns. It's not optional. It's fundamental to preventing those hospital-acquired infections that are such a big focus for JCI and NABH.
And linked to that, I imagine, is not touching stuff.
Absolutely.
No.
Do not touch any medical equipment or monitors, period.
Even accidentally.
You have to be really careful. These machines are critical. Bumping a line, pressing a button, it could have serious consequences. Leave it all to the staff. They know what they're doing.
Okay, hands off the equipment. What about how long you stay?
Right. Don't overstay your welcome.
Because long visits are tiring.
Very tiring for the patient primarily. They need rest, but also it can disrupt the flow for other visitors or for staff needing to do things.
The sources mentioned keeping it short, like 5 or 10 minutes sometimes.
Yeah, examples like that came up. Depends on the situation and the policy, but the principle is quality of presence, not quantity of time.
That's a good way to put it. Okay, another big don't seems to be about interacting with the staff.
Specifically, overwhelming them with questions, especially at bad times.
They're busy, focused on care.
Exactly. Don't interrupt them mid-task or during stressful moments. Find an appropriate time. Maybe ask when a good time for a brief update would be. You have to trust their expertise and respect their workflow.
And definitely don't ask sensitive medical questions in front of the patient.
Oh, absolutely not. Hearing discussions about their condition, treatments, worries that can just spike their anxiety when they're already feeling vulnerable. Save those questions for outside the room.
Okay. What about bringing things in? Food, flowers.
Generally, don't bring unapproved items. No food, drinks, flowers, unless you've specifically checked and gotten the okay from staff.
Because of sterility again. And maybe dietary rules.
Both. ICUs have to be kept incredibly clean, and patients might have very specific dietary needs or restrictions. So always check first.
Makes sense. And the last don't seems more about general conduct.
Yeah. Don't cause a scene, don't argue, don't crowd the waiting area. It just disrupts the whole environment.
Which needs to be calm, especially near critical care.
Exactly. Any issues need to be raised calmly, respectfully, usually with the nurse in charge. Keeping things orderly helps the staff do their jobs.
So it seems like what you should bring is like your ID, maybe a handkerchief, but mainly just a calm, supportive vibe.
That's the core of it. And avoid bringing things like phones if they're restricted. Definitely food or gifts unless cleared. And crucially...
Don't play doctor.
Right. Don't give medical opinions unless you actually are their doctor.
It really sounds like it boils down to discipline, compassion, and just keeping your composure.
It does. And these aren't just random suggestions. They're the practical application of those high-level patient safety and quality principles right there at the bedside.
Like that quote you mentioned, the most powerful thing you can bring is calm respect.
Yeah, that really captures it.
So thinking about all this, what does it really mean for you listening? I mean, this deep dive, it's shown us this framework, right? Organizations like JCI and ABH setting these really important standards globally, nationally.
Foundational work for quality and safety. And then you see the role of consultants, like Supreme Medic, helping hospitals actually put these complex standards into practice.
Bridging that gap we talked about.
Exactly. But then, crucially, these sources took us right down to the human level, to the ICU visit.
Yeah. And those detailed do's and don'ts we unpacked, they're not just arbitrary rules, are they?
Not at all. They're concrete actions, designed specifically to protect patients who are really vulnerable, to support the staff doing critical work, and honestly, to make sure your visit actually helps.
So understanding these guidelines, it kind of empowers you, doesn't it? You go
Yeah.
from feeling maybe a bit helpless in a scary place.
To being an active, positive part of the support system by being disciplined, compassionate, mindful.
You're contributing to that healing space.
Right. So here's something to think about. Consider how following these specific guidelines that come directly from efforts to improve patient safety and quality, the kind of stuff JCI and NABH focus on, how does that not only help the patient you're visiting,
But also maybe make things less stressful, more effective for the doctors and nurses working flat out in there.
yeah, think about that ripple effect. If every visitor brings that calm respect, follows the hygiene rules, keeps visits appropriate.
Could those individual actions, all added up, actually improve the overall quality and safety of care in those really critical moments?
It suggests that, our individual actions really do intersect with these big healthcare standards, and maybe understanding how to navigate the ICU visit is just sort of the first step in really supporting a loved one on their whole journey to recovery.